Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. I want to bring your attention to the fact that we're seeing a growing incidence of fatty liver disease problems in our society and around the world. So fatty liver problems are divided into two main groups: those caused by excess alcohol intake and those not caused by excess alcohol intake. So to reverse early stage fatty liver problems caused by excess alcohol intake, the solution is very simple. You drink less alcohol or you avoid it altogether. But what is really alarming is the exponential rise in fatty liver problems that are not caused by alcohol intake. In fact, it's estimated now that 25% of the world's population currently has this problem, and in the United States it affects 30% of the population. So the recent rise in non-alcoholic fatty liver problems, which is known as NASH, by the way. NASH is NASH, non-alcoholic steatohepatitis, but it's really fatty liver problems not linked to alcohol, largely attributable to the rising incidence in overweight and obesity statistics in many countries. However, many non-overweight and non-obese individuals also develop fatty liver problems, which the evidence indicates is primarily due to the overingestion of simple sugars, especially high fructose diets and soft drinks or sodas, and unhealthy fats, foods that are high in saturated fat, deep fried foods, trans fats. So the reason this is important is because fatty liver problems are the first step in the development of liver fibrosis leading to cirrhosis, which is a life-threatening condition, as well as primary liver cancer. This cancer is known as hepatocellular carcinoma, and it's very lethal. In fact, as a result of increasing fatty liver problems in our society, the once quite rare hepatocellular carcinoma is becoming a much more prevalent form of cancer in modern society. We are now seeing an increasing number of people with non-alcoholic fatty liver problems progressing directly to liver cancer first without developing cirrhosis as the interim sort of stage. So you go right from fatty liver problems directly to primary liver cancer, or hepatocellular carcinoma as it's known. Data shows that the non-alcoholic fatty liver degeneration is the fastest growing indication for liver transplant in patients with primary liver cancer. Not only that, but individuals with fatty liver problems are at higher risk for developing type 2 diabetes and premature death and complications from cardiovascular disease. Now, some people can inherit genes that give them a greater risk for developing non-alcoholic fatty liver problems, but even in these cases, the principal cause is faulty diet and lifestyle patterns. There are no drugs that effectively reverse this form of fatty liver degeneration. The treatment and reversal of non-alcoholic fatty liver problems comes down to changes in diet and lifestyle, as well as the possible inclusion of some supplements shown to help to reverse this condition, which we'll talk about in the next update. Now, regarding diet and lifestyle, the emphasis should be on things that lower your insulin secretion and improve your insulin function, as high insulin levels convert more calories that you eat into fat within the liver cells, which is really the underlying problem in fatty liver disease, which happens you store more fat within your liver cells and you start to damage the liver cells. So regular endurance exercise is very helpful. Something as simple as a 30-minute power walk each day can help to lower your insulin levels and improve insulin function in the body, which decreases the conversion of the carbohydrates and proteins that you eat from becoming fat and being stored as fat inside liver cells. Now, consuming fewer foods and beverages with simple sugars is also critical because it also will lower your insulin levels, and that will decrease the conversion of carbohydrate into fat within your liver as well. It's also important to avoid bad fats, such as high-fat meat and dairy products like red meat and pork and processed meats, butter, cheese, ice cream, as well as deep-fried foods like French fries and chicken wings, and foods with trans fats and other undesirable fatty foods such as cream sauces and creamy salad dressings, tahini sauce and mayonnaise, just to name some very common offenders. So in the end, the goal is to consume lean protein foods that don't have a lot of fat: chicken breast, turkey breast, egg whites, fish, soy-based proteins, and not ones that are deep fried or breaded. Reduce your intake of heavily sweetened foods and beverages like pastries and candy and sugar-sweetened soft drinks, And to use lower dairy, lower fat dairy. If you're going to use dairy products, use lower fat dairy products like 1% or non-fat milk or yogurt. Try to avoid cheese and butter and cream and whipped cream and ice cream. And replace creamy salad dressings with olive oil and vinegar dressings. Avoid tahini sauce and mayonnaise. And use tomato sauce or olive oil-based reductions or sauces in place of cream sauces on pasta. Get in your 10,000 steps a day or at the equivalent using some type of other endurance activity. This overall strategy can not only reverse non-alcoholic fatty liver problems, but it also prevents the problem from developing in the first place, along with preventing the development of metabolic syndrome and type 2 diabetes. Now, in the next update, I'm going to explain the research showing what specific dietary supplements and doses have been shown to also reverse non-alcoholic fatty liver problems. I think you'll be surprised and impressed with what we've learned from the human clinical studies that have been conducted so far. But how would you know if you even have a fatty liver problem in the first place? Well, at your next annual physical examination, make sure your doctor includes your fasting triglyceride level and standard liver function test in your blood panel workup to screen for a potential fatty liver problem that may be festering behind the scenes. This is important because fatty liver problems don't show up in terms of different signs and symptoms. It's picked up by simple blood panel tests, and because it's so common in our society today because we eat so poorly, a lot of people have it and they don't realize it. If it's not reversed in the early stage, this can easily progress to life-threatening cirrhosis or primary liver cancer, hepatocellular carcinoma. So I've included the research references for this in the text below. Thanks for watching, and I'll see you next time.